Ultrasound has improved patient outcomes in terms of safety, in terms of accuracy. You can deliver medicine to a much more specific target and be much more precise in my injections. My name's Trent Brereton. I am a naturopathic doctor and I'm in Cranbrook. I graduated in '97. I did my first injection course in 1998, and over the course of the years I've started doing more and more injections. 2 years ago I started with ultrasound and I dove in. I've taken a bunch of courses, and now I'm a co-owner of West Coast Injection Training, where we teach naturopathic doctors, medical doctors, and nurses how to do ultrasound-guided injections. And I also teach for Sports Medicine Ultrasound Canada, which is a medical group that mostly teaches MDs, sports medicine docs, ERs, and surgeons how to do ultrasound-guided injections. Ultrasound totally changed my practice on many ways. First off, I sleep better at night. Honestly, that was the thing that was the initial motivator. I got sick and tired about worrying about where my needle tip was during the day, and I would wake up worried about patients and calling folks, checking in. So it was highly motivating to get into ultrasound. And so personally, it's been helpful in terms of sleeping better, being more confident. My patients love it. I spend a lot of time educating and using the ultrasound as an educational tool, and they're so excited to see the image on the screen and know how specific and accurate we can be with an injection with an ultrasound. And of course, that comes with great patient confidence in what we're doing. So patients are much more willing to come back for therapeutics. They talk to their friends, and people get better outcomes when you're more accurate with your injection. In my practice, I have two different fee structures. One fee structure is using the ultrasound, and the other is when I'm doing landmark guided. The vast majority of injections I do is ultrasound guided, and that I charge $300 an hour when I'm using the ultrasound, plus certain procedure fees on top of that. When a patient is confident in what you're doing and they tell friends and friends tell friends, it rapidly builds a practice. I physically can't make more money in my practice now because I'm booked every day that I'm in clinic, and I'm just one person. In the 2 years that I've used dedicated ultrasound guidance, my practice has grown 30%. For naturopathic doctors who have multiple clinics, who move between rooms, who do home visits, a wireless handheld device is a perfect ultrasound to use because you can carry it with you, literally put it in your bag and have a phone or a tablet and you're in business. Whereas cart-based machines take up a lot of floor space. The image quality is excellent. For a linear probe and more superficial structures, it's excellent. You get clear definition. The bony structures show a nice white reflection. Well, the main thing about Clarius that makes it an advantage is its cost. If you're new to injecting or new to ultrasound and you're at all concerned about price, then the Clarius is very affordable. And when you're using ultrasound in an injection-based practice, a few $1,000s is a drop in the bucket. A person who invests in an ultrasound at that price point will make it back in a very short period of time. Ultrasound has improved patient outcomes in terms of safety, in terms of accuracy. When a patient knows that you can see exactly where you are, they're more confident in what you're doing, and that in and of itself improves outcomes. If people have trust and a sense of confidence in what you're doing, they're going to heal better than if they're wondering what the heck you're doing. And if you're fumbling around or sweating, and people can smell when you're not 100% confident about where you are. And as a landmark guided injector, there's always a sense of uncertainty. I will not do any injections that are remotely deep into the tissue without an ultrasound now. I used to do it all the time. I will not touch a spine without an ultrasound, and I will not do intra-articular injections without ultrasound now because it just makes you extremely safe.